The topics and opinions expressed on the following show are solely those of the host and their guests, and not those of W4CS Radio, its employees, or affiliates. W4CS makes no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. Any questions or comments should be directed to those show hosts. Thank you for listening to the Cancer Support Network on W4CS.com.
Hello, everyone, and welcome back to Survive and Live Well, tips to treat and beat cancer. As always, my goal is to empower you with information to help you regain control of your health. Today, we're going to talk about hyperthermia for cancer. And I have with me one awesome doctor and one awesome and grateful patient here to share with you the benefits of hyperthermia, a safer and gentler way to treat cancer. Dr. Axel Weber runs the Clinic Marinus, a hospital in Brandenburg, Germany. He is also a surgeon who believes it to be completely inappropriate to treat prostate cancer with surgery. He has extensive experience and excellent results with hyperthermia, especially for prostate cancer. The team at Clinic Marinus believe that we hold the key to healing within ourselves. Their goal is to provide natural healing-oriented treatments to support our efforts in healing and aim at the best possible quality of life for patients. They combine treatments of conventional medicine with established methods of naturopathy. Eric Blumenthal was diagnosed with prostate cancer and consulted one of the major cancer centers in the United States. When he heard the proposed treatment plan, he was not impressed. Being a young, vibrant, and wise man, he set out to find other options. Because as I always say, if you don't know your options, you don't have any. So Eric and Dr. Weber, thank you for joining us today. I am very excited to bring this information to my listeners.
Mm-hmm. Good.
Thank you.
At first, my name is Weber. I'm a surgeon by myself, and you told the members that I am not against operation, but in case of prostate cancer, so I don't recommend operation. Why? You know, the operation is not sure. Also, after operation or irradiation, the patient must check the PSA. That means we are not sure that we healed the patient. And that's why we have another program to fight against cancer on the prostate. At first, the hyperthermia. I do it since 25 years with a good success rate. The hyperthermia we do with a special catheter. I bring it in the prostate through the urethra with the anesthetic gel, and we make an overheating of the cancer. That means the prostate. It has no side effects. We don't destroy the sphincter. We don't destroy the normal tissue, but we have the chance to kill tumor cells with a hyperthermia. And it's very important to make it over a time of 2 hours with a temperature from 113 degrees Fahrenheit. We have 45 degrees Celsius here in Germany, in Europe. And this procedure is not painful. And after 2 hours, after the overheating, I bring out the catheter. And the patient has a little side effect. Maybe it burns in the urethra for a short time, maybe 2 hours, but no bleeding and no other side effects. Important is that we have this overheating. The first effect from the hyperthermia is that we kill the tumor cells because the cancer cells don't like overheating. This is the first effect. The second is that all medications work better in an overheated tissue, like in a normal temperature. And I made a scientific report. We show the patient, we can show the patient with an electron microscope what happened in this tissue. We have a concentration of our own killer cells during the hyperthermia. This is the third effect of the hyperthermia. And I think the hyperthermia without side effects has much better effects without side effects for the future of the patient, you know? Mm-hmm. And the hyperthermia is one part of our treatment, the importance part, right? But I never recommend the hyperthermia alone, because I must see the whole patient, the whole person. the cancer is only a part of the person, and I must see that I help the whole body to fight against cancer. Because it's possible that our immune system can destroy cancer cells, tumors, and so on. And so I make a combination between the hyperthermia and a holistic treatment for the whole body. That means I boost the immune system with the oxygen therapy, so own blood drips, a high dose of vitamin C, a high dose of selenium, a magnetic field therapy, and so on. And this combination shows very good effects.
Yeah, I like that idea of treating the whole person, the hyperthermia with the holistic modalities, really to boost that. Because again, if we fix the cancer with the hyperthermia, but we don't do anything else, we're not really changing that cancer environment. So I think that's very, very important. Yeah. So, go ahead.
Yes. So one advice, I make also a combination between the immune boosting therapies, but and the hyperthermia, and I give also medications against cancer. Good, I have a combination between school medicine and alternative medicine. I think I have no miracle pill, that's right, but I think it's a combination for the whole body, together with hyperthermia and together with medication against cancer. So I think curcumin IV or artemisinin, Chinese wormwood preparation, what helps against cancer. This shows the good effect for the future. And it's much better for the patient, like to destroy the sphincter, the urethra, and so on. And I said it at the beginning, I'm a surgeon, I'm not against the operations in case of cancers, breast cancer, and so on. But in this case of prostate cancer, we have much more success with this treatment with the hyperthermia as the school medicine only with the operation or the radiation. They forget the whole body. They make only this local therapy, and we have no 100% success rate with the operation or radiation. Here in Germany, we have 80% survival rate in the next 10 years. That means 20 patients will die in case of prostate cancer, also after radiation or operation. And this, we have a better success rate in the next 10 years with the hyperthermia.
Right. That's right, and less damaging, which is very important to many people who are seeking alternative options. So, Eric, would you expand on your story and explain to us how you ended up choosing hyperthermia and why in Germany?
Yeah, why in Germany?
Well,
Oh, sorry. Did you ask me?
That was Eric. Yeah. Eric is going to answer that one.
Well, obviously when I was diagnosed with prostate cancer, I was, in a very, very depressed mood at that point, and I was kind of a little bit lost, and, I started to seek advice, and really pretty much, to summarize, the options I was giving is cut, burn, which is, have a surgery or radiation, and I'm 48 years old. I was first thinking about saving my life, but then I was thinking about, maybe I have some issues with erection, and I'll have to be on it will definitely affect my sexual life. So that was the secondary concern. And then one night I was, basically for 1 month I didn't go to work. I was just reading and Googling and trying to search for other options. And obviously beside radiation or surgery, there was what they call active surveillance. And I was asking myself, well, what is really active surveillance? It's just wait and see, basically. It's not active surveillance. It's just like waiting for what? And I couldn't live with that thought. And I said to myself, got to be another option. But at the end of the day, I Googled and I started to ask myself, why is there so many celebrities from the U.S. are going to Germany? I mean, after all, I'm originally from Israel. You probably can pick up my accent. In my mind, America is pretty much a standard for everything. And we have the best economy. We have the best of everything. So how could it be Germany? So that was, first of all, I was reading about hyperthermia. It made a lot of sense for me, but I still had a lot of doubts. And eventually, there was a story in Israel back in 2000 where a group of elite divers claimed that the polluted river caused them to to have a cancer, and they took it all the way up to the defense ministry, and it was a big scandal in Israel. It's called the Kishon affair, if anybody wants to look it up. Make the long story short, I was able to contact one of these elite divers who wanted to share the story with me. He was treated in Germany, I believe in St. George Clinic. He was pretty much, according to him, on his deathbed, and he refused to get any more chemos. And he basically said to the military, I'm willing to die and not take any more chemos. You're poisoning my body. I want to have this treatment in Germany, or I would rather die. So they sent a group of doctors, and they had to approve the treatment, which they did. And make the long story short, 12 years later, the guy's running a marathon, and and doesn't have any signs of the cancer. So it's like, to me, it's like, what these stories. I read a lot of them on the internet. I had a lot of doubts, but again, America has the best. Everything here should be the best. I'm not going to Germany. This is not making sense to me. But after speaking to someone like that, that's it. I was sure. First of all, I had nothing to lose. It was not invasive. It didn't prevent me from, if I wanted to have the surgery, And I can tell you, I'm a new person right now.
Well, you make a very good point. Right. You make a very good point of how you got there, and that, that you're a new person too, but how you can change your mindset. We do think that we over here in America we have the best of everything, but we're very rigid in the way that we work. I can't even imagine some Navy SEALs here saying to the United States government, I think you guys probably have a great system, but I'm out of here. Please send me to Germany so I can get my treatment. I'm not sure it would work so well. They'd be sent off for more chemo or have to pay for it themselves. So that's pretty exciting. I think when you mention the elite divers, it's kind of like the Navy SEALs in my mind. So
correct.
Yeah, that's a great story. I think that those firsthand stories where you hear people who broke away from the traditional mold and went the alternative route and came out whole and said, wow, it's not just some hokey story I heard on the internet. This is real. So can you tell us a little bit about what your week was like? You were there about a week?
Yeah, so, the experience is unbelievable. The moment you land in the airport in Munich, there was a driver waiting for us. He took us to the clinic. That was on a Sunday. The place is located in the Bavarian Alps, I believe in a village called Brandenburg. Just a beautiful, charming village. The whole clinic looked like a 5-star hotel. It's, I was there on Sunday. Monday right away I started with immune boosting therapies, ozone therapy, and oxygen therapy. And basically the whole idea was to boost up my immune system. So I will start the first session of hyperthermia on the following day, which was on Tuesday. But right away on Monday, I felt the difference when Dr. Weber spent at least an hour with me and went over the whole treatment, which, comparing to my urologist, who basically spent 4 minutes with me and ended up giving me the option of, surgery and basically traditional robotic. Here I'm sitting with the doctor, spending an hour with me, and really going everything that I'm about to experience during that week. So I was very, very impressed. I felt right away that I'm in the right place. And, on Tuesday I started the first session. There were 2 sessions of hyperthermia. It's about 2 hours, when Dr. Weber, during the 2 hours, by the way, was like at least, I would say, an hour sitting next to my bed. Just specifically about the treatment, you're sitting in the bed. In my case, it was local hyperthermia, and they insert a catheter through my urethra all the way to my prostate. You feel a little bit of sensation, not the most comfortable, but it's okay. It's not that painful. It's not painful at all, I would say. And you're sitting there. He's raising the temperature to, I think 45 degrees Celsius. Correct me if I'm wrong, or 42.
Right, 113 Fahrenheit, right.
And and it's done. And then you're out of there, and then you continue with your the stuff is very efficient. Every 20 minutes, you're doing something else. On Thursday, I repeat it again. On Friday, he said, go back to the U.S., monitor your PSA. Obviously, he gave me a Zolidec. A Zolidec was, hormone therapy for, I believe, 1 month's effect, just in case any cancer cells escape the prostate. This way, that will kill it. And he did it during the hyperthermia, which is more effective, what I understood. And, we expected that the PSA, when I came to the clinic, was 3.7, 3.8, will obviously go down to maybe 1 because of the hormone therapy, but that was a 30-day injection. So after that, it went back to 2.4, and it remained at 2.4. It stabilizes at 2.4. I'm monitoring this at Sloan Kettering, and so far I can tell you that from my urologist that there is really no sign of my prostate cancer.
Fantastic. Just, you don't have to answer this if you don't want to, but what was the reaction at Sloan Kettering when you came back without your prostate cancer and everything else intact and working in order?
Yeah, my doctor was like, what did you do? And I explained to him, and he said, can you tell me specifically which clinic? So I gave him that. So he didn't say much, and then in the next visit he said, whatever you did, I think there may be a good chance that they cooked all the cancer cells. So I was surprised he did not try to say, hey, this is not a traditional way, and this is not the way we do it in the U.S. I was kind of expecting that, but he sounded more positive, and he said, I think you did the right thing. But, right now I'm just monitoring this, and I'm doing what is called active surveillance, but I really feel that it's true active surveillance is not a wait and see.
Right. I was going to say there's a difference between active surveillance after you did something and active surveillance prior to doing anything. So that's completely, different in my book. Well, I'm really impressed. I think it's good because the more doctors that understand that we as patients want to pursue our options, and I think it's great that they're following up with you now and kind of embracing the option that you chose as opposed to bullying you and saying, well, it's going to come back. That's not a treatment for cancer. So that is really great. Very, very good news. So, Eric and Axel, maybe one of you can describe to us how hyperthermia is different in Germany than is what is currently available and approved by the FDA in the United States.
Dr. Weber, you want to answer that?
Yeah, okay, I can do it. We have a problem in U.S., I know, but I'm sure in 20 years we have the possibility, the patient has the possibility to make the treatment with the hyperthermia also in the U.S.
20 years, okay.
Yes. In the 17th, or in the end of the 16th, the 17th, 18 years, we had doctors here in Germany or in Europe. They saw that the patients with a lot of fever, with a high temperature, sometimes after inflammation, have not so much cancer. And they were very interested to find out what was the reason. And they find that the temperature in the body, when the temperature is higher, that it's possible that these patients get not so often cancer like patients who have no fever and so on. And then they try to make a treatment with a high temperature. At first with the whole body, and then later they make a local hyperthermia. And this especially hyperthermia by this catheter, transurethral hyperthermia, they produce this catheter later since 20 years. Good. But we saw that the effect against cancer cells is very good. And we find out, or the doctors find out, that it's a tumor substance like this overheating. And that's why we have the possibility here in Germany now. Good, we have also problems with insurance. Some insurance tells the patient, no, we don't pay it, it's not good, and so on. But the hyperthermia is here in Germany now as a fourth possibility to treat against cancer. Also in school medicine, we have parts of universities or parts of clinics, they do the hyperthermia. But we see that we have a good success, and I think, and I hope it for the patients, that this is also possible in the United States. And I'm sure that when we have a lot of patients also from US and we have success, that they show other patients, other people, this possibility with a hyperthermia. And so maybe the FDA will have another opinion in the next years. I hope it for the patients, because it's not easy to find a way from US or from Canada to come here or overseas and to make a treatment here. It's not so easy. It would be better for the patient when they have the possibility for treatment with a hyperthermia at home. But I think it needs some years, and then it will be possible. I hope it for the patients.
I hope so, because 20 years, most of us don't have 20 years to wait for our treatment. That'd be nice if we could, but then it's just not practical. And so the difference here in the United States, just to mention this, is in Germany, you can bring temperatures up to 45 degrees Celsius, which is 113 Fahrenheit, versus in the U.S. it is only 42 degrees, and perhaps I believe not for the same duration. Is that correct?
Yeah. We have the temperature, I make it with 45 degrees, the hyperthermia in the US. I don't know if they take only 42 degrees Celsius. This I don't know. But we have a higher temperature because it's necessary to heat the tissue or the cancer over 42 degrees Celsius, because only with this temperature we can kill the tumor cells, Mm-hmm. Only 42, it's borderline. You have a good effect for the immune system, but you can't kill tumor cells when you don't get temperatures over 42 degrees Celsius. That's why we must treat with temperatures with 45, so we have the chance to kill the tumor cells.
Great, that's a great.
I actually checked that at Duke University. They started to implement hyperthermia with chemo, low dose of chemo, and you're right, it's 42 for 30 minutes, and as opposed to for 2 hours and 45. So
it's 42 for 5 minutes. Is that what you said? 42 for 5 minutes?
For 30 minutes.
For 30 minutes. Okay.
For 40 minutes? No. I think it's not enough. I mean, you need 2 hours. It's a good time. And there's 2 times in 1 week in case of cancer in the prostate. So we need this time. We need this temperature. When I treat with this 42 degrees Celsius, so I have not so much effect. Maybe I have not success for the future. We can't kill the tumor cells with 42 degrees Celsius.
Right. That makes sense. Okay, so then, Eric, what was, I know you mentioned to me that, and Dr. Weber also mentioned that we talk about the holistic modalities. What kind of conversation did you have at the clinic on where do I go now? What's my protocol when I go home? What did you do there, but also what do I do when I go home?
Good. The procedure is when the patient comes, and Eric told us, I speak with the patient. It's very important, when a patient comes with a diagnosis of cancer. So sometimes he's a little bit depressed and so on. And I try to give him hope, real hope, because I can tell him that I have a lot of patients in the past and that he has a chance to bring out the tumor cells with my help. Good. I have no miracle pill. I'm not the healer. I'm a tool from him, and I give the patients a hand, and then we can fight against this cancer together. But I have a lot of patients in the past with success in fight against cancer, and that's why I can recommend this treatment. I can speak with the patient, or I recommend this hyperthermia, I recommend the other treatments, because I have a lot of patients with a successful treatment in the past. But it's very important that I have time for the patient, because I told you, the situation for a patient with cancer is not easy. And that's why I can speak with him. I show him other cases that I had patients 10 years ago with a PSA from 5,000, and he is alive. And this hope I can give the patient when I show him a file from a patient who has bone metastasis 10 years ago, and he is alive. So it's very helpful for the patient to fight with the mind against this cancer. I think it's a very big point. We forget, often we check only the PSA, maybe MRI and so on, a lab test, but the mind is very important. And when a patient has hope, so we can help much better. with the hyperthermia or the other treatments. And then we start with treatment and we do it, I see the patient, I think I saw you every day, Eric, is it right? Yes. And so we make this treatment, and at the end of the treatment, I make a report together with the patient, what we have done and what he can do at home. That means I recommend medication, new tests. I keep in touch with the patient, and so we can work together also after treatment in the Marinas Clinic.
Well, I love the idea of hope. I imagine that the Israeli diver found hope in Germany that he didn't find in Israel at the time. And I think the mind-body connection, both with hope and everything else, is huge. Just like you say, Dr. Weber, it's at least 50, if not more, percentage of the whole battle. So, Eric, how did you feel about being told you had to make lifestyle changes?
Oh, well, I didn't understand you now. Please, sorry.
Oh, I asked him. No, that's okay. I asked Eric to tell us how he felt about making these lifestyle changes.
Eric.
Well, I think the most important thing I learned over there is that in Germany they're not just focusing on treating the cancer, they are really educating you or treating your whole body, because really, essentially, your body has been poisoned. And what really caused that? And it's obviously stress. It's the food. It's cancer loves sugar. I mean, cut down on sugar, cut down on the meat, and what I really learned is like really I have to make lifestyle choices. And since then, really, since I came back from Germany, I'm not eating any meat. I cut down on bread completely, on sugar. So it's not just go home, monitor the PSA. You really have to make lifestyle, changes here, and also exercise. And so I'm really taking my time. I'm trying to change my lifestyle. Like once in a while, Dr. Weber says, "Hey, you can sit down with your wife and have a cake, but don't do this every day."
Right.
You can't just go and eat the filet mignon every day, So that's what I used to do before. And really, I try to go home 6 o'clock and kind of shut down my phone and just try and be with my wife and the kids, and try to learn this European lifestyle of separating between work and home, which before that I was wired 24/7, and really my diet was horrible. So I think that's the one thing I took from this treatment as well.
Yeah, it's a life lesson for everybody. Some of us embrace the changes. Some people say, "Well, I can't do this and I can't do that." Well, you have to work with what you can do. But that idea of shutting down and separating your work and really taking time to take care of you is so very important. So that's great that you embrace that. Eric, likely you chatted with some of the other patients there, and not that we're trying to, do that whole telephone, he said this and she said that, but can you share some other stories that you learned over there about people who had success and hope and why they came to the clinic?
Right. So there was a lady over there that I think was treated for breast cancer that according to her was going very, very well. She was there on the third week, and I think the tumor, shrank by like 75%, according to what she said to me. And during the week, there was another patient, I believe from Hong Kong, that had a huge tumor in his throat, and it was huge when I came over there on Monday. But on Friday, when I saw him before I left, it was like, I would say, 25% of the size. And I asked him, on Monday he couldn't even speak. We were sitting every day in the dining room. But on a Friday I was able to talk to him, and he sounded like a person who really did his homework and researched this thing. And, he started to feel the progress, and he mentioned that he would be there for another 2 weeks. So, I mean, this is more or less what I noticed over there, and a lot of the patients they want to keep to themselves, and I understand not everyone wants to talk about it, but in no way the mood was depressing or anything like that. It's not like you walk into a place and you feel like, oh my God, I feel like everyone here is just
on their deathbed.
People been in a very good spirit, and they're talking about everything. And Dr. Weber and his wife, she's a doctor as well, and it's just so friendly. I mean, see Dr. Weber helping a patient walking up the stairs. I mean, stuff that you're not used to see here in the U.S. And it's just like the whole staff. They're so efficient, so friendly. They know everything. Every treatment is on time. It's really like a machine. The place is just so efficient. It's just unbelievable. Really,
it sounds like it does sound unbelievable, and it sounds like a place where you are not a number. You are very much, just like we said, Dr. Weber sat by your side for an hour. It sounds like you are a person that they truly care about healing, as opposed to just another person with cancer. And I love that. That's what I get from this conversation. I got a lot from the conversation, but I love that feeling. So, Dr. Weber, we talked mostly about prostate cancer and a little bit about breast cancer. Are there other cancers that you have had great success with hyperthermia?
Yes, I think we have a good success also with the other hyperthermia. We have patients with breast cancer, with bladder cancer, with colon cancer, liver metastasis, lung metastasis, and so on. And I make the treatment in these cases with a local hyperthermia. And the local hyperthermia is very helpful in the whole treatment. And the hyperthermia has no side effect. It's very important. I get also temperatures over 42 degrees Celsius. I get temperatures with 45 degrees Celsius. But it's not painful. The patient lies on a waterbed. On the waterbed is copper electrode, and then we have electrode. We put it on this area where we want the hypothermia, and this we do all 2 days. That means 4 times, 3, 4, 5 times per week for 1 hour. And this hypothermia has the same effect like the transurethral hypothermia. It means we make it overheating, we can kill tumor cells. And this hypothermia is also a part of the holistic treatment. And in other cases, in breast cancer, bladder cancer, so it's different, a little bit different, the treatment of the prostate cancer, but the program is the same. That means the hypothermia, the immune boosting therapies, Eric told you what we did, and the medication. But the medication is sometimes a little bit different. When a patient has a prostate cancer, Eric gave the Telatex injections because of Selenium. But it's not a hormone. It's a hormone blocking therapy. I don't give hormones, in other cases, I must recommend other medications when a patient has bladder cancer and so on. But the hyperthermia is in all cases we do the hyperthermia local or transurethral, or also sometimes the whole body. But the whole body is only for the immune system. We can't kill tumor cells, and this is the reason why I prefer or recommend this local hypothermia in case of other cancers or metastasis.
Okay, so breast cancer, bladder cancer, colon cancer, metastatic colon,
liver
metastatic
lung metastasis, and so on. Yes.
And liver too. Great. And what about children? Do you or do any of the other clinics treat children with hyperthermia?
No, children not.
No children.
Because we can't treat children. I have never treat children. That's why I say to the patient, be careful with me, careful with doctor, and ask another one. But when I never treat children, and that's why also the government says, yes, your concession is so that you can treat adults but no children, and so we can treat children in the clinic.
Okay, great. And what kind of costs would a patient, let's say the patient was coming from the U.S., what kind of costs would a patient incur for, let's say, a typical average treatment from maybe a 1 week treatment, 2 week, or 3? You can.
The costs So we have the cost good. We have two possibilities. One time is to treat the patient as inpatient, and the other side is outpatient. The treatment is the same. As inpatient, sure, it's more comfortable. You have your room, you can sleep in the clinic, we cook for the patient and so on, but it's expensive. When I make all the program, and so I must tell you the whole program, we make in the week every day oxygen therapy, we make every day a time peptide injection, 2 times per week we make a methylene therapy, we make 3 times per week also an own blood infusion, high dose of vitamin C and selenium, we make 2 times per week a detox food bath, we make the magnetic field and so on, we make foot reflex zone massage, we make the hyperthermia 3-4 times a week, and but the whole cost for the room, the catering, doctor fee, medication, hyperthermia are 5,000 euros. But at the end of the treatment, the patient gets a bill, and he must pay only this what we have done. You know, when we make only one hyperthermia, so it's less than 5,000, but 5,000 you must see 5,000 approximate. And when the patient is outpatient, so it reduces the costs. So we have between 2,500 and 3,000 per week for the treatment.
All right. Well, while you might say that sounds very expensive, and it is very expensive for someone coming from the U.S. and has to pay out of pocket, it's certainly far cheaper than conventional medicine here in the United States.
Yes, I know. Yes. Yeah. And I think we can do all for the patients. And Eric told us, I think it's very important that the patient feels a good atmosphere. You know, it's very important when we make a treatment against cancer, that he feels good, that he is helpful, that we are friendly, but we are inside friendly, not only to the patient, you know. We hope it's inside that we have success. And I can bring my hope only then to the patient when I have a real hope in my soul, you know. And I think the patient and the staff feel it, and so we can have success, because the mind is very important. And I can say, yes, my diagnosis cancer is not good, it's depressed and so on, but we have a chance together to bring out this cancer. And it's also a thing of the mind. I tell the patient, we must speak with your cancer. You know, I'm a surgeon. I think I'm a surgeon, I know the hyperthermia is important and so, but a patient must speak with it. It's a part of him. It's a part of his body. And I say, when you go to bed, please put your hand on your cancer and say, hey guy, we was together for a long time, but now it's time that you go out of your body, of my body. When you kill me, you will die too. I think it's also, yes, it's also a part of the treatment, not only the hypothermia, not only this treatment with medication, not only operation and so on, but it's very important that we bring out the cancer cells also with the mind. This is important.
I love that. It's one thing to go to a cancer center and be treated for cancer, but to feel that person really has your genuine interests in mind. Yes. That when a patient feels cared for and loved by the people that are caring for them, I think that is, as you say, it's part of the treatment, and it gets lost. Right, it gets lost a lot of times. So
they look at this treatment and they look only to the MRI and they say, yes, you have now a tumor, and the success rate is so. Maybe you die, you have metastasis next year. This is a percentage for the success or not. So I take the hope from the patient. You know, I must say no. Yes, there is a tumor, but we fight against this tumor. You have a chance. And I don't see only the leptas. I see the leptas. I don't forget it. But I don't see only the leptas. I don't see only the MRI. I need it. I know. But the whole body, to speak with the patient. This is very to give him the hand. You know, and this is important. And then we can have success. More success than without this treatment for the mind.
All right. Now, Eric, how do you feel about that? Obviously, you were there for the week, and now you're home getting your follow-ups. What's your overall impression, again, for everybody on how you feel about it now? You said active surveillance, and you're happy with that, but your scans are going well, or your blood tests, I mean?
I mean, the one advice I can give is anyone that's in my situation where they're facing a decision between surgery and active surveillance. One thing I learned from Dr. Weber in Germany is they don't believe in biopsies over there. They don't believe so much in the surgery because if you think about it, by actually performing the surgery, you may be, or the surgeon may be spreading your cancer cells all over your organs and setting up a time bomb in your body. And that's a pretty scary thing for me to think about that while I'm performing the surgery, but why do I have to continue doing those PSA tests? And so if this thing is coming back, it's going to metastasize all over my body. I don't have a prostate. So, even the simple fact of doing the annual biopsies, the cancer cells may be, escape the prostate and spread over your body. So, to me, it's very, very logical, and I feel that I made the right decision. And like you said, 50% is psychologically I have to feel empowered, I have to feel like I'm back to myself, and I'm definitely myself. And I would suggest that this is non-invasive. It's 6,000 euros. Not that expensive, considering the fact that your deductible on the surgery will probably be the same. So,
that's right.
Right? I mean, you're going to Germany, going to a beautiful place, and I mean, this thing can really turn to be, the best decision you made. So, I can't speak for everyone, but I can tell you I'm extremely, extremely happy that I finally, flew to Germany and did this, because I had a lot of doubts, and I just wasn't sure that this is the right thing. But like I said, I recommend that anyone who's facing or thinking about active surveillance, that's what it really means, active surveillance. You're going over there, they're essentially cooking your prostate, and really cooking and burning all the cancer cells out of your prostate. Nothing is guaranteed, but also the surgery is not guaranteed. And
I was just going to say, there's no guarantees. That's
Yeah.
right. This is especially for a very young person who has a long life to live. You want to have a sex life. You want to be able to, not get up 17 times during the night to go to the bathroom when you're 48 years old. There's a lot to be said for looking for the best option for your cancer. And there is an expense, but you also were only away for 1 week. You didn't miss 6 months or 12 months of work because you were debilitated with treatments or recovering. So there's always that side of it too. That I think that's a big deal. I have one quick question for Dr. Weber. You spoke about high dose selenium, and I'm a big promoter of selenium. I think it's a great for most people. I mean, it's estrogen metabolism, can help with a lot of things, but there is no concern with people who have had prostate cancer with taking selenium.
I give selenium every patient because selenium has in the dose of, I give it IV with 150 micrograms. I see that the selenium has a very good effect against the free radicals, When a patient comes, so I check the free radicals. It shows that the patient often has oxidative stress, and we have good success with the selenium. And I recommend it for IV, good when a patient is for the prostate cancer only 1 week in the clinic, so I give it only 1 or 2 times. But when the patient is longer for treatment against cancer in the breast or in the colon and so on, so he stays for 3 weeks, and so I do 6, 7 IV trips with high dose of selenium, and I see that the free radicals goes down, and this is very important for the future, for the immune system. That's why I recommend the selenium. Also, the high dose of vitamin C with 7,500 milligrams and so on. But I see a good success with the selenium, and I recommend it also to take selenium at home in form of ampoules to drink or medication and pills and so on.
Right. I mean, I agree with you completely. I mention it only because there seems to be a campaign here in the United States to go after anyone who's even suggesting antioxidants and, these are the worst thing you can possibly do, and all the negatives. I mean, of course, I am right there when you're talking about synthetic, junky, supplements, but quality, properly produced supplements are so important, and so I appreciate that insight because I don't want people to be misled here by the media, and that happens very often. So thank you for that that information. So we have a couple of minutes if anybody has one more story they would like to tell us. I know, Eric, you told me about this doc from New York that moved to Israel and opened a clinic, and I thought that was really fun. How he went over there and started the clinic because he really saw the value in it. And so that was a good one. But I'm open to any stories. We've got just a couple of minutes here to share something.
Really, the one thing, again, is I can't believe how it was before the trip and how I am right now. I'm back to work. I'm functioning. I was like completely, removed from life, from the life of ambitions and the life of, chasing things and trying to plan for the future. I mean, I felt like, when I got the news, like I'm out of this race. And and thanks to Dr. Weber, and I'm back. And that's precious. That's unbelievable.
It is huge because the cancer diagnosis, hearing those words, you have cancer, our first reaction was, okay, I'm checking out. That's the end of me. I'm done. My goose is cooked. It's over. And then you come to reality and say, okay, it's not a death sentence. Like, I can do this. And, we all face that. But then we have to find, as you did, the best option for our cancer and not just settling for whatever some doctor says that you say, I don't know, that doesn't sound good to me. It doesn't sound right. So I absolutely applaud what you did to find the treatment that felt right to you. And obviously it's worked out very, very well for you.
And I felt like the system here, at least when it comes to prostate cancer, want you to submit to this old-fashioned and cruel and harsh treatment that you have here in the U.S. And it's very, very hard to overcome and to think that you fly 8-9 hours, and it's a whole different treatment plan and a whole different hope. And, it's just very, very hard to overcome.
Well, that the word patient comes from the Latin word suffer and submit. While the doctors here don't want you to suffer, they certainly want you to submit to whatever they say you're supposed to do, which causes suffering for most of us. So, I'm glad you didn't become just a patient. You took control of your health, and it sounds like you are really doing great. So, Dr. Weber, I really appreciate your calling in here from Germany. I'm glad we got the time zone down because it's a little confusing for all of us, especially when we have so many different time zones here in the United States. It's very confusing. So I'm glad that we had this opportunity to chat, and I know that our listeners really appreciate it because there's been a lot of conversation on the social networks about this upcoming show and talking about prostate cancer and talking about hyperthermia, and I think we have given a lot of answers to people that they were seeking. So I appreciate this very much. And Eric, this has been great hearing somebody who's been there, done that. Feeling fantastic about it. It's very helpful for people to hear. We learn, we listen, and we read about things, and nobody knows, is this real? Like you said, I don't know. I was a believer, but I don't know. Do I really want to do this? Go to Germany, and I don't speak the language, and the whole thing brings on. It's very disconcerting. Sorry, go ahead.
Yeah, I think, yes, sometimes we have a little bit of problem with the language, but Eric was in the clinic, and I think the understanding was not so bad. We are happy that comes people from the United States, and when we have a lot of patients, so they can tell other patients in the United States that this is possible to make a treatment without this aggressive treatments of school medicine, only with radiation, only with chemo, and only with operation. They must know that this possibility is there, and I hope really that the patients in the US get this possibility for treatment with hyperthermia in the next year. I hope it. In the next years, I don't know when. No.
Well, I hope so. I hope so. I
Yeah.
hope
But in
that-
this time, we are here, and many patients contact us from UNES, and I'm happy that we can help in the most of these patients.
Well, thank you. Well, we are very grateful for you both and for all the work that you are doing, Dr. Weber. We are out of time now, so I want to thank you both again. Thank you very much for joining us
Okay.
and
Thank you.
sharing this
Thank you.
information. Oh, thank you.
Thank you, Dr. Weber. Shalom.
Thank you, Eric. Yeah, we keep in touch, Eric.
I was teaching him Hebrew, you teach me German. That was the deal.
Good. Thank you.
That is a good
Bye.
deal. And thank you to
All right.
all our listeners for joining us today. This has been Survive and Live Well, Tips to Treat and Beat Cancer on Cancer Support Network, W4CS.com, where you can listen live Tuesdays at 1 p.m. If you missed any part of the show or need to replay it, you can catch it on my website, www.ellenjacobs.wordpress.com. Join us next week when I chat with Dr. Jamie Griffo, making babies after cancer and all the issues and everything you want to know about cancer and fertility. This is your host, Ellen Jacobs, one-on-one cancer coaching, empowering you to treat and beat cancer. See you next week.